Hello, hello. Thank you for having me. I'm Dr. Tamara Beckford with Your Caring Docs. I am an emergency medicine physician, and I'm also the CEO of Your Caring Docs, where I help organizations to reduce their stress and burnout in their employees through self-care workshop. I'd love to first thank the Faith and Mental Health Conference for having me as a speaker. Today, we're going to be talking about one of my favorite topics, which is self-care. Alrighty, let's get started, right? So our topic for today is self-care as a powerful tool for mental healing. Self-care, a powerful tool for mental healing. All right, let's get started. Now, when we really look at the statistics, it is very jarring, right? Over 50 million people in the United States are suffering from mental illness. Over 50 million. Now, 1 in 5 people will go and suffer through some type of mental illness within their lifetime. Within their lifetime, absolutely. And 50% of people, so when we remember back in college, when you're sitting down, they said, look to your left, look to your right. At the end of the time, one of you will not be here. Unfortunately, similar things are happening with mental health. Around 50% of the people will be diagnosed with mental health during their lifetime. That's right. So half of us will be diagnosed with a mental illness during our lifetime. So that's why it's so important to figure out what are some ways for us to really deal and to handle with mental illness. Now we know medications are absolutely available, treatments are available, but what about using the power of self-care? And that's what I'm going to talk about today. All right. Alrighty. So now why is self-care so important? Why is it so important? Because using self-care, especially with mental health and mental healing, it will allow you to recognize patterns within your emotions that causes triggers, right? So you're recognizing these patterns that causes triggers, and you're going to identify activities that bring you pleasure to break those triggers, and which is very, very important, right? So recognizing the pattern and then using activities to break those patterns and using activities that will bring you happiness and relaxation, which is very important during this healing process. Now, when I really think about the definition of self-care, there is a standard definition and then there's a definition that I like to use. So the standard definition of self-care is practicing and taking an active role in protecting your own well-being, right? Protecting your own well-being, happiness, and particularly doing that during times of stress. So it's actively taking a role in protecting your own well-being and happiness, particularly during times of high stress. I like to call that aligning my mind, body, and spirit. That's right. So, what is not self-care? Now, we've talked about what it is, protecting our mind, our body, and our spirit, and doing so actively, right? It's our own, protecting our own well-being. However, self-care is not something that should be forced upon you, right? It should be something that refuels you. So, what activities that I do for self-care might not be the same activities that you will do for self-care. My activities will fuel me. Your activities need to refuel you, right? So it's very individualized, and that's important for us to keep in mind. Now, I know when we hear about, like, well, what are some of the things that one can do? What is self-care? Is it that I get my nails or my hair done? Or is it going on exotic vacations? Mm, not necessarily. Those are nice. And if that makes you feel great, absolutely. However, there's some people that if you set a standard schedule for me to go and get a massage every 2 weeks, you have stressed me out. As opposed to another person, you will have been providing self care because that relaxes them. So that's how individualized self care is. But there are things that, the active person can naturally do, which is a part of self care. So movement, rest, absolutely, rest. So movement, rest, proper nutrition. All of those are important parts of self-care. Yes, I know. So we're thinking like, okay, exercising, yes, but I call it movement. So we'll talk a little bit more about that later, right? Practicing gratitude, mindfulness, excellent parts of self-care. And these are things that we can do on a consistent basis that really helps to elevate our mood, which is very important. And we'll talk more about that soon. Alrighty. So if we think, okay, well, why is all of this important? I see that others do it. But yeah, if we really even look in the Bible, Jesus did it. He participated in his self care. How many times did Jesus retreat himself from others? He retreated himself with his disciples. So that's his team, that's his spirit, that he's aligned with those who are like minded, right? And sometimes he retreated himself by himself, right? For times of isolation in order to prepare his mind, his body, and his spirit. Rest and renewal is a huge important of self-care. And I say, if it was good enough for Jesus, it's absolutely good enough for me. So when we follow the examples, we can see that rest, renewal, some is important. Time for yourself is important, right? Being around like-minded people is also very important. Now, I'm going to talk now about the benefits of self-care in three of the top mental illness disorders that we have today, right? So one of the three top mental health disorders is anxiety. Now, I know a lot of people who suffer from anxiety. You know, you might be there and you see them and you're like, why is this person panicking? Why are they dealing with this? There's nothing going on. I have no idea why you keep coming up and why you're always so anxious and panicking. So let's go over the official definition of anxiety so we can have a little bit of an understanding, right? So anxiety is a mental condition characterized by excessive apprehensiveness. That's a worry about real or perceived threats. So it can be a real issue that's going on. I'm very anxious because I might be getting evicted. I don't have the money. You know, it could be a real danger is I'm walking down the street. I'm consistently having to walk down a dark alley when I get off of work. Of course, that will bring about anxiety, right? Or it could be a perceived threat where I am feeling anxious over something that I saw happen to someone, and I'm afraid that this might happen to me. It's not actively going on right now, but it's a perceived threat. I'll give you an example. As I mentioned, I'm an emergency medicine physician. So during the time, we know we had the unfortunate incident with Breonna Taylor. I had a patient who came to the emergency department a few times for anxiety attack. What was going on with this young lady? She was the same age range as Breonna Taylor. For those who don't remember, this is the young lady who was shot and killed in her apartment when law enforcement officers came in. She was asleep during the time, right? So my patient came in. She is around the same age. She is an African American female. She lives by herself in an apartment. At nighttime, she was unable to sleep. She had panic attacks. She was coming into the emergency department with her heart racing, which is the physical manifestation of anxiety that happens to most people, tensing of her muscles and feeling just very, very tense. Now, the threat that she had at that time was an perceived threat, understandably so, but the manifestation of it was still very real, right? Was still very real. And that is anxiety. That's anxiety. So, what are some ways that someone who is dealing with anxiety can really help themselves through self care techniques, right? Very, very powerful technique is breathing exercises. Deep breathing exercises can help with anxiety. Now, why is this such a powerful tool? When one is anxious, you're going through the fight or flight response, right? So your body is in that fight or flight. I need to get away. Danger, danger, danger. And as we said, sometimes it is a perceived danger, but this is our natural evolutionary way that our body has helped us through the time in order for us to survive. We've all heard about the saber-toothed tiger that's chasing us along. This manifestation of the fight or flight response comes from that. However, right now, you are not being chased. You are sitting, but your mind and it's still giving off that fight or flight response. So the breathing technique, taking those deep breath in and out, breaks that cycle. So it brings you into the rest and restorative portion, right? So you move from the fight or flight to the rest and restorative. Now, why is that so important? It shows statistically that you can actually reduce the symptoms of anxiety by 44% by using deep breathing exercises. 44% reduction in the symptoms of anxiety. So, what's going on right now when you're doing that deep breathing exercises? You're releasing natural chemicals within your body. So, two very powerful chemicals, one dopamine and the other serotonin. So, what is dopamine? Dopamine is our pleasure or happy hormone. Serotonin, when it's been also released within our body, it gives the lasting feeling of happiness. So now no longer are you in that fight or flight. You've broken it, and now you're in the rest and restorative portion, and you're starting to have feelings of happiness, of ease, and it's starting to last a little longer. So knowing that just that powerful technique, 44% of those who are using it can have an improvement of their anxiety, right? So, our next top three mental illness that affects those of us, especially in the United States, is depression. So, we finished talking about anxiety. The second one is depression. So, now, like we said, what is the definition of depression? So, depression is a mood disorder that causes people to feel sadness or loss of interest. So, you will lose not just a loss of interest in things, but loss of interest in things that produced or gave you pleasure prior. You know, loss of interest in even just getting out of bed. So someone who has been depressed, even just movement is a huge chore. And of course, we know that having depression is a gateway to leading to suicidal ideation. And this is why it's so important for us to find ways in order to help, right? To find ways to help with the improvement of the mood that can occur during depression. As we mentioned, there are medications that are available, but there are also techniques, which are self care techniques, that can be used to augment those medications. You know, interestingly, I interview a lot of doctors. At this point, I've interviewed almost 200 doctors on my podcast, and I've interviewed psychiatrists. And I asked one of the psychiatrists, she was telling me about treatments for depression, and this is what she said. She said, the number one treatment and first line treatment for depression is exercise. Mind blown. Exercise. She says we do not prescribe it enough, but exercise is one of the best treatments for depression. Now, if you think about it, when one is depressed, the last thing they want to do is move. And that's probably one of the reasons why the movement helps so much, right? So, what are some benefits of movement that can help to offset and to even treat some types of depression, right? So, according to the Journal of Preventative Medicine, in a 12-week, they did a trial for those who were feeling depressed. And the 12 weeks of movement exercise, they were able to reduce the depressive symptoms by 47%. 47% with just movement. So that's how powerful it is. Now, why is movement, what is it about it that really helps? So when we start to move, you've heard of the runner's high. We release these chemical endorphins. So endorphins are naturally released, and the endorphins, what they do is that they decrease the sensation of pain. It is almost equivalent to some of the pain medications that are given in the hospital. And this is naturally reduced or released by our bodies through movement, through exercise. That's how powerful it is. If you have ever been depressed or you know anyone who's been depressed, like we said, movement is the last thing you want to do. And your body probably aches because of the depression. So you start to feel pain with even just movement. Now, this movement and endorphins that are released can decrease the pain. And it produces the sensation of the runner's high. So you start to feel energized. And well, I'm up. Let me try to do one next thing, right? And then afterwards, well, now let me try to do the next thing. And these are the small but powerful ways of using this self-care technique of just movement to help with depression. Now, you heard me say movement. I didn't say exercise because there are a lot of different ways to exercise. If dancing to your favorite song and busting a sweat is what it is, that's movement. If it is yoga, that's movement, right? Some people like formal exercises, some people like Zumba, some people just want to just listen to a song that made them happy back in the days and dance to it. Movement in any form is important, right? So we just went over anxiety and depression, and now we'll talk about the third of the most common mental illness that affects us in the United States and also the world. And the third one is stress and trauma. So, how can we use self care to help with stress and trauma? We'll talk about this next, right? So, let's now get the definition of stress and the definition of trauma. So, what is the definition of stress? Stress is a state of worry or mental tension that's usually caused by a difficult situation. So it's worry, it's mental tension caused by a difficult situation, while trauma is the emotional response to that stressful event. Trauma is the emotional response due to the stressful event. As I mentioned, I've spoken to many psychiatrists, and one of the interesting facts that I found out about even trauma and the traumatic incidents and the way that our body chemically reacts to it, our body will chemically release its hormones and the neurochemicals to a stressful situation lasts only 15 minutes. 15 minutes. Think about it. We have been dealing with the trauma and the stress for years, but the initial response was only 15 minutes chemically. So, what causes that continuation? What causes that continuation? It's caused by our response to it, what we tell ourselves towards those incidents, towards the event that happened. And each time we tell ourselves something negative, I should have, if only I, this is probably my fault because we release some more of those negative neurochemicals, and then we start to spiral, and then we say more negative things to ourselves, and then it continues and continues, right? But what is a way that we can use self-care to help with the mental healing process to stress and traumatic events? And now I do want to give you the caveat that I'm not saying that this is the only way to deal with it. Absolutely not. Yes, therapy, medication is important, but these are ways that we can augment that, right? By using our natural tools, which is self-care to help. So, what is a great and a powerful way to help to deal with that? And that would be through meditation, mindfulness meditation, and gratitude practicing. Mindfulness meditation and gratitude practice. So, really, yes, really. Let's think about this. Statistically, it shows that for those who are practicing mindfulness meditation in a randomized trial, those who have gone through stress or in a high traumatic situation and been able to do this, they've been able to reduce their perceived stress by 35% by just mindful meditation. When we think of mindful meditation, what is it that we're doing? What are we doing with mindfulness? We're thinking about the here and the now. So the what happened before, what's going to happen in the future, what am I doing next week? What are the things that are on my plate? No, we're really gathering for the here and the now. And then what is the gratitude practicing? I am grateful for, and you're thinking about the things that are great that we're grateful for in our lives. If we really extend and extrapolate gratitude practice and mindfulness, what do we have? That's right, prayer. Prayer, right? So those are our natural self-care tools that we have to help us during times of stress and to help us to battle some of the trauma in our lives. Prayer, which is mindfulness meditation and gratitude practicing. So when we really think about it, you might be listening and you're like, oh, this is great. Yeah, Dr. Beckford, you're telling us to do all these things, but I don't know if I have the time. And I definitely can't pay for a huge program. And, it's just me, it's all on me. Well, what are some ways that you can do this for free? Because this is free, right? So the best way to think about it is one, set some time aside for yourself because that is very important, right? So setting time aside for self-care is absolutely important. We all have heard the adage, put the mask on yourself first before you do it on others. I'll add something too. When I spoke to one of my colleagues, she said, I minister from the saucer ministry. And I thought, the saucer ministry, that sounds interesting. But when I thought about it more, you have the cup and your saucer. So once her cup has overflowed, whatever is in the saucer, that's what she's able to give. So her cup is always filled and she's always able to give her best. So, what are some quick ways for you to do that? One, schedule it. Schedule it. Be intentional with that, right? Be intentional with scheduling self-care. Be intentional with scheduling time to movement, time for breathing, time for gratitude and mindfulness practicing. It might require you getting up maybe 20 minutes earlier in the morning. Schedule it. For those who schedule and put it on their schedule, they're 80% more likely to get it done. So if you think about it, say, it would be nice, you're less likely to get it done. If you put it on your schedule and say, tomorrow, when I wake up, I will do this, you're 80% more likely to get it done, right? So schedule it. Breathing techniques, 5 minutes. Do it in between work. When you're walking and taking your bathroom break, you can do your deep breathing exercises that time, right? When you get home from work, you can walk around the block. As we said, It's just movement that's important. While you're doing any activities during the evening, you can add movement to it in order to release those endorphins. Now, I know you might have heard the doctor say 30 minutes of exercise 3 to 5 times a week is great, but those 30 minutes don't have to be continuous. You can break it into 10-minute sessions and still be able to get that movement, right? It's just the act of doing the movement that releases the endorphins. All right. So, as we mentioned, that's free. And the best thing is, do that and you'll be given from your salsa ministry. Now, imagine you taking that commitment to yourself to be able to give yourself time to use these practices, these self-care techniques to help you battle anxiety, to help you battle depression, to help you battle stress and trauma, and knowing that these are free techniques and these are chemicals that we have within our body naturally that we can release to help us during those times. How powerful will that be, right? How powerful it is to use what we naturally were given to the best of our ability to help us during those times. I tell you, that's absolutely important. Now, as we said before, 50% of those in the United States will have a mental illness between now and the end of their life. You might have had it before. You might be someone who's seen someone who's had it. These techniques are techniques that are just so powerful that you cannot just keep them to yourself. Don't keep them to yourself. Start today. Start anyway. Start just with one particular thing. If it is tomorrow, being intentional about your gratitude, practicing, just start. Just start. As we say, put that oxygen on yourself first before you put and give to everyone else. Remember the salsa ministry. Let's give from the salsa ministry. So I'm going to leave you with this. This is from an author. Her name is Mandy Hale, and also from a suicide loss survivor whose name is Jennifer Williamson. She said, "It is not selfish to love yourself, take care of yourself, and to make your happiness a priority. That's not selfish, right? That's part of self-care." And it goes along and says, there is enough time for self-care. There isn't enough time to make up for life if you've missed filling yourself up. With that, I'd like to thank you, and I'd like to urge you to use self-care as your powerful tool to help you with mental healing. I'm Dr. Tamara Beckford with Your Caring Docs. Thank you, and I hope that you enjoyed this presentation.